this video, we're going to show you exactly what your specific condition entails, how to properly treat it, and maybe more importantly, how to keep that pain from coming back for good. Hi, I'm Johnny with MJ's right here in Fulton County, Pennsylvania. I've been treating this area and the surrounding areas for well over 12 years. I have 30,000 plus hours of actual hands-on experience in eliminating conditions just like yours. I hope you find this video valuable, and thanks for watching Pain Elimination TV.
Okay, let's take a moment here and look at your specific condition. Headaches or migraines. Something I want to speak about very quickly is 90% of the people out there with headaches and migraines are tension related. There is less than 10% of the people who are having food allergies or allergies from the environment, chemical hormone imbalances, sinus issues, and so on. But 75% of the people who go to the doctors are referred to certain medications based on all those conditions without really having an answer of what their migraines or headaches are caused by. And that's because most medical professionals have no true way of dealing with tension. So just going into this video, I want you to understand that if you are a headache or migraine sufferer that are possibly on some of these powerful medications and not getting the relief that you want or deserve, it's because more than likely you fall into the 90th percentile. Some of you watching this video, of course it is possible that you fall into the 10th percentile. Before we get to the 90th percentile, which is usually referred neck pain based on tension due to postural imbalances, stress, anxiety, and depression, let's look at those few percent of people who actually have a headache. Now, a headache can actually be caused by these big muscles up here that go across the skull. And every once in a while they will get tense due to typically things like stress or strain of some sort. And a good scalp massage or pulling of the hair might be enough to get some blood circulating in there to relax the area and calm down the headache. Another muscle on the actual head that may be causing the headache is the temporalis, which is greatly involved in chewing and can cause some pretty severe headaches, especially if you're somebody that suffers with TMJ. If you are somebody that suffers with TMJ, make sure you watch our video on TMJ. Getting rid of your TMJ can be a great way for you to get rid of some of your chronic headaches. Now let's go to the 90th percentile, where it is actually referred neck pain causing your headaches. Now if you look at the neck, this is the neck as a whole. And over here I got rid of a few muscles so that we can see deep down in the neck itself. This is a very serious place of nerves, lymph systems, veins, and arteries. This is not a place that should be taken lightly, nor would you want this place worked on by a beginning therapist or an uneducated therapist, a non-experienced therapist, because there's too much damage that can be done here. It's quite a busy highway of activity. But so we can get a clearer look at this tension-related referred pain headaches, let's get rid of some of the stuff, get it out of our way, so that we can look at the muscles in more detail. Alright, let's take a look at this group of muscles right here. These are the scalenes. There's a couple groups of scalenes, and they're very small but yet very important and powerful muscles. They can become extremely sensitive, extremely sore. But what's interesting about these muscles is they will refer pain up to the side of the head. So a lot of times if you're rubbing your scalp trying to get rid of your actual headache, you're wondering why you get no results, and that's because this is not the area of pain. You would actually want to be relaxing this area and this area, so it would stop referring the pain to the side of the head. You would also want to take a look at this big powerful muscle here, the sternocleidomastoid. Now when it's flared up and it is causing it can become very sore and very irritated just to the touch itself, but a lot of people don't actually feel the pain there, so they'll automatically assume that their headache is up in this region. Sometimes a little bit forward here, but usually on the top and slightly lateral from this muscle here. So when you're rubbing your scalp, rubbing your head and stuff, trying to get rid of the headache in that capacity, you're wondering probably why you're not getting any relief whatsoever, and it's because you really need to be relaxing this muscle here. Alright, you would want to stretch it out, you'd want to massage it. You can do an ice heat combo, and you would want to primarily place the ice here where it attaches, and you could put some heat along its actual belly. And last but not least, everything from the traps to the subscaps and to the semispinalis capitis that all come in here and attach right to the skull and underneath the base of the skull. These places back here will end up referring pain actually to the front. So a lot of people will think that they're having everything from the frontal lobe here down into the eyes, into the sinuses, and they'll think they're actually having some kind of sinus problem, some kind of sinus headache, something of that nature. I get a lot of people that come in with headaches and they claim that they have some pretty serious sinus issues. At least that's what they have found out by going to their other professionals, and lo and behold, they realize that once you relieve the pressure off of these muscles here, their sinus problems decrease, or at least what they thought was their sinus problems, and their headaches fade. And of course, if you keep that area of the neck happy and satisfied, the headaches will disappear permanently. There's a lot of reasons why we get the headaches we get based on postural imbalances. When you think about the neck itself, it's usually being pushed forward or pulled forward by something that we're doing. Everything from our computers to our smartphones to driving our car to reading a book, and the list goes on. Also, you have to think about gravity pulling us forward and downward. So a lot of times these muscles in the front, and there's quite a few of them, we won't go over all of them in this particular video to keep it short for you, but just look at all these muscles that attach to the front. Okay, they will grow chronically shortened, which will pull the neck forward, which will then put these muscles on a stretch, which will then put them in a chronic contraction to try and keep your head up out of your lap, which will inflame them, especially in places like where they attach to their actual sites onto the skull, and because of the different nerve and fascia patterns, they'll refer pain up to the head. So let's do one quick recap here. When you think of things like the actual scalenes, you're going to think of pain that's referred up to here. When you think of muscles like the actual sternocleidomastoid, you're going to think of pains being referred up to here and laterally. When you think of the subscaps, semispinalis, and the traps, you're going to think of pain being referred up to these areas. Every once in a while you will actually have a headache by this muscle or by this muscle or a combination. Now if your neck is in really bad shape and you put your neck through a lot of torture, you're going to find that all the muscles that we have pointed out to you are all going to be chronically shortened, probably all slightly inflamed at their attachment sites, putting too much pressure on things like the fascia and the nerve trains, and your entire head can hurt. It can get so bad for some people that they'll actually even explain it as their hair hurts. And that's where you would want to work on the entire neck. But typically we want to teach you something here today that's pretty important. A lot of times people will feel the tension that they're having back here on the back side, and they'll ask their spouse, their loved one, somebody to massage. They might actually use some ice or heat back here. They might even try and stretch these muscles out. The problem is these muscles here are already overstretched. So by stretching them out, you're usually not accomplishing anything, and in some cases you could be making the situation worse. You would actually want to take and stretch these muscles. And these would be the muscles that you would want to massage and put some heat and some ice and really open all this up. You also would want to open up your chest and the areas here along your sternum, because everything in this region is way too tight, chronically shortened, and putting pressure on the back side. Once you have resolved your headache problems, you probably also have some mild, whether you realize it or not, because your focus may be on your headaches, but you probably have some mild to severe chronic neck problems. And after you get the front of the throat, neck region there all stretched out and relaxed, then what you would want to do, and this would take time of course, but you'd want to come back into these areas, into the traps, into the rhomboids, and of course the semispinalis and places of this nature, and you would actually want to strengthen them so that they don't have to work so hard to fight against all the everyday activities that's pulling your head downward and forward. But if you went out to try and start strengthening your neck immediately, you would find that you would probably create a great injury, and you would probably feel much worse than you do now. So remember that headaches are typically the cause of referred pain patterns from the neck. If you want true relief from your headaches, and you're not getting relief in any other way, relax the neck, massage the neck, ice and heat the neck. Really put the neck in a comfortable, relaxed position to where it doesn't have to strain. No computers, no smartphones, book reading. Give the neck about 10 minutes of complete and utter relaxation. And one of the best ways to do that is to lie back on your bed, on the floor, or in your recliner. Take a towel and wrap it really tight and put it underneath the base of your skull to where your neck can just rest there. And take a 10-minute break. Do some deep breathing. Open up your chest a little bit. And watch how you have the capacity to relieve the headaches and possibly even make it go away. I hope this video was valuable. Now that you better understand your headaches, perhaps the next time you have one coming along, make sure you catch it early. Don't wait until the headache gets out of control. Catch the headache early. Based on what you learned here today, go to the proper muscle and relax that muscle in the neck and create some wonderful relief.
I hope the time you spent watching this video was valuable. Now if you want to be pain-free within 30 days or less, please give me a call. Let's talk. Phone number is 717-404-6495, and you can sign up for our pain elimination package, which guarantees with your specific condition we will eliminate that pain in 30 days or less with a satisfaction guarantee. If you're not satisfied at the end of the 30 days, you get your money back. And our pain elimination package is half price. So if you want to get rid of your pain in 30 days or less, give me a call. And thanks for watching Pain Elimination TV.